أعوذ بالله السميع العليم من الشيطان الرجيم من همزه ونفخه ونفسه بسم الله الرحمن الرحيم نحمده ونصلي على رسوله الكريم أما بعد. Welcome again, dear viewers, to Medicine and Islam, a program sponsored by Sharjah Television that features topics relevant both to the field of medicine as well as to the great religion of Islam. Alhamdulillah Rabbil Alameen. Today is part 2 in our Ramadan special 2011. Our topic today is breastfeeding in Ramadan. Breastfeeding in Ramadan. And I'm happy to say this is the first time that we have dedicated a complete program just to this topic. Our guest today is Dr. Evelyn, who is head of the lactation department at the Sharjah Maternal and Child Healthcare Center. Dr. Evelyn, assalamu alaikum.
Wa alaikum salam wa rahmatullahi wa barakatuh.
Of course, now you've been on my programs before talking about the lactation clinic and your work there. For those viewers who did not have the opportunity and chance to see your previous interviews, can you briefly just tell us something about your training and your background?
Yeah. So I was trained as a family physician in France, and I came to work here in Maternal and Child Health Center in '98. I became also a lactation consultant because my interest is a lot about the psychological, emotional, physical well-being from the start. And breastfeeding is involved. It's the base, it's the foundation.
Yes.
And as a volunteer, I also participated to the support group Breastfeeding Friends, which belongs to the Supreme Council for Family Affairs of Sharjah.
Very good.
And they are doing a lot of wonderful social work.
Very good. So initially your training was in family medicine, and then you did a further training in lactation, specific for that. Ajib. Now, of course, before we talk about the specifics of breastfeeding in Ramadan, the do's and don'ts and the ins and outs, we want you to tell us just a brief summary of what the concept of a lactation clinic is. Because I never heard of this before I met you, actually, to be honest. Just for our viewers, just tell us about the concept of the lactation clinic.
Actually, the concept is well summarized by this sentence. It's from the Journal of Human Lactation, that without skilled support available to mothers, efforts to promote breastfeeding offer little more than empty promises. It means if for a long time health professionals have told mothers breastfeeding is best, you should breastfeed your babies and this. But this is promotion. It needs to be going hand by hand with support, clinical support, emotional support, to be there if they have any difficulties. This is the concept of a lactation clinic. And the aim of lactation consultants, to give clinical, practical support, not only speaking and teaching and health education. Of
course, the origin of the concept of the importance of breastfeeding is from the Quran, isn't it?
It is.
And Surah Al-Baqarah. So that is kind of like the foundation of, of the lactation clinic. And then you go from there.
And there we are helping mothers with a whole range of difficulties which can be solved, like positioning, like you see here, like just changing the position of the baby at the breast, or dealing with more difficult cases, babies, preterm babies, cleft palate, babies with cleft palate, mothers with chronic infection, many things. And really mothers, they feel empowered to be supported like this, and they are so determined, and they are wonderful.
This is something that really needs more education and more media involvement, isn't it?
Yes.
Well, thank you so much for being with us. Now, of course, we're here mainly because of Ramadan. The holy month of Ramadan is upon us, as we say, is now upon us. So now, what's the first thing that comes to your mind when you think about breastfeeding and fasting? What do you think about?
The first thing that from my experience, personal and in the working with a lot of mothers in the center, that it's very commonly mothers can manage to combine fasting and breastfeeding. But in the case they cannot combine it, the question is what is the priority? Is it fasting or is it breastfeeding? And you ask the question in the right son, it is breastfeeding from Islamic point of view and medical point of view. If both cannot be combined, breastfeeding should continue and fasting should be stopped.
I think you should repeat that. That's an important point.
Yes.
Or let me repeat it. Yes. So if you can do both, fine.
Yeah.
But if you cannot do both, the priority is clearly breastfeeding.
Yes. From Islamic point of view and medical
both
point
ways.
of view.
Of course,
Yes.
Islam.
It goes hand by hand. Yes.
How many things in the Quran were there hundreds, even thousands of years before medicine discovered
Yes.
it?
Yes.
So you find no
Yeah.
contradiction
Yeah.
usually in sound
Yes.
medical knowledge and Islamic teachings.
Yeah.
So
And
this is one of the main points of this program
Yeah.
is to make that clear to our
Yeah.
viewers that if you can do both, then that's fine.
Mm-hmm.
But
Yeah. And
if
we'll
you
give
can-
some practical tips how
I'm
to
sure
combine
you're going to
both.
show us these nice slides of yours. If you
Inshallah.
can't do both,
Yeah.
then breastfeed.
Yes.
Yes, and
Yes.
don't fast.
Yes. Because any other option is inferior.
Subhanallah.
It's clear.
Okay, now, of course, now you're not the only one there. You have staff, you have
Mm-hmm.
people working with you. How do you prepare your staff for the various medical conditions of your patients that would determine whether you advise them to
Mm-hmm.
fast or not while breastfeeding? How you get everyone in your group, in your jamaat,
Yeah.
so to speak, ready to advise the people and prepare people for Ramadan?
This is an ongoing process. I mean, we have weekly clinical meetings, and yearly we have Ramadan, and in this country, in our center, we have mainly pregnant women and breastfeeding mothers. This is the patient that we are caring for. So it's like something that's well known by the staff, and if there is any new study or any document like this one from the NHS Ramadan Health Guide, which has been done in conjunction with Muslim doctors and Muslim Council, it's a very interesting one. So if there is any new studies, we discuss it. And
This guide is prepared by whom?
in UK, the National Health Services.
Okay,
National
really?
Health Services,
Ramadan
yes.
Health Guide.
Yes, Ramadan Health Guide, yes.
Never heard of that.
A guide to healthy fasting.
Is it available online?
Yes, it is. Yes, you
Okay.
can just Google it, Ramadan Health Guide. You put NHS or you put Communities in Action.
Communities in Action.
Yes.
And it will all come up, this information.
Yes. And there is even the main
Excellent.
points in Arabic, in Urdu, in Bengali. I mean, the main points
it's
are
multilingual.
And it's also some for health professionals themselves, non-Muslim health professionals, to explain them what is Ramadan and in which cases they. I mean, it's
Very
interesting. Yeah.
So you have weekly classes there or meetings there?
With the staff, yes.
With the staff?
Yes.
About the patients?
Yes, we
Okay.
discuss cases. We
And
discuss
how far
new
before
researches.
Ramadan do you start talking to the mothers about this?
Usually within the months, just the months before, they will ask us, the mothers,
Shaban,
by
basically.
themselves.
Okay.
Yeah.
Now, I was thinking about this as I was preparing the questions. You ever get cases where you have pregnant women who are also breastfeeding? Does it
We
happen?
have, yes, we have.
It happens from time
yes,
to
it
time.
happens. Yes.
So this is kind of a myth that people think that if you're pregnant, if you're breastfeeding,
Yes.
you can't get pregnant. Of course, you
Yeah.
can.
Yes.
It's not very common, but it happens.
It
We
needs
do
a
have
whole-
some patients
It needs
like
a whole mission, a whole program on it.
that. Okay.
What is
that?
the birth spacing while breastfeeding and things like this? I mean, it takes time.
Yeah, it
to
takes
cover it.
time. That must be
But,
very difficult to fast in that condition.
Yeah.
Okay. Now, do
Yes.
you have pamphlets and printed information about this as well?
No, because most of the time you're right, we should, but it's individualized
Okay.
a lot of time.
Customized, so to speak.
Yes, but for the general practical advice, it would be nice to have a pamphlet. I
Okay,
mean,
this may be
it
something
would be
good.
yes, a good
Because
idea.
I noticed that the patient's friends you find them everywhere now. In all the Sharjah co-ops, you find
Yes.
the booths and you find information.
Yes.
This might be a good idea,
Yes.
for your section as well.
Yes.
If you could put something together for a few pages in
Yeah.
Arabic and English, it would be a
Yeah.
good idea. And are there any type of workshops that are done outside the clinic?
You mean especially for breastfeeding and Ramadan?
Yeah, or just
Oh,
breastfeeding
no.
in general that mentions this?
Yes, we have a lot of awareness activities, especially with breastfeeding friends. We're going in the community, even in the
Right,
jail,
right.
in many places.
Right. Now,
yeah.
breastfeeding friends, of course, is the bigger picture.
Mm-hmm.
The clinic is the actual physical place where you do the work.
Mm-hmm.
But breastfeeding friends, and many people, and I was under the misconception that this whole breastfeeding friends concept is just for Sharjah. It's not. I mean, the Supreme Council for Family Affairs
Yes.
is for the whole UAE, isn't it?
Yeah, we have support line. Everybody can call us, and usually we can